Hi, I'm Lexi. I'm a doctor at the Royal Children's Hospital in Melbourne. One of my jobs as a paediatrician is taking care of preschool children with asthma, kids between 1 and 5 years of age. To help you feel confident in managing your child's preschool asthma, I'd like to share some of that knowledge with you now. First, let me explain what happens inside the body when someone has an asthma episode. Asthma symptoms are caused by narrowing of the small air passages in the lungs. This change happens in 3 ways. The lining turns red and swells up, the air passages make sticky fluid called mucus, and the muscle bands around the air passages become tighter. These changes make the airways narrower, so it's harder to get air into and out of the lungs. It's a bit like trying to breathe through a very narrow straw. In many cases, the first time a parent will notice something that might be asthma is when their child wheezes. Wheezing happens when the small airways in the lungs become narrow or tighten. It can make it difficult for a child to breathe. Wheezing is very common in the first few years of life, but not all children who wheeze have asthma, and wheezing isn't the only sign of asthma. We'll talk about other signs a bit later. When wheezing happens, you might hear a whistling sound as your child breathes out, but sometimes you can't hear it at all. Other names you might hear asthma called in children aged 1 to 5 are viral-induced wheeze, preschool wheeze, childhood asthma, or salbutamol or Ventolin responsive wheeze. Babies up to the age of 12 months often wheeze, but when a baby wheezes, it's usually from a condition called viral bronchiolitis, or they can wheeze simply because they have small and floppy airways. Babies aged 0 to 12 months should not be diagnosed with asthma, and it's rare for them to be given puffers or asthma medications. So, how do doctors decide if your child has asthma? There isn't a specific test, like a blood test, X-ray, or a lung function test that diagnoses asthma. Instead, we make the diagnosis based on your child's symptoms and whether medication helps. A child can be diagnosed with preschool asthma if their symptoms such as shortness of breath, wheeze or cough get better after using asthma medication prescribed by their doctor. A lot of the time, it's parents or caregivers that may see the signs of asthma in day-to-day life. Recording this for your doctor can help. But the most reliable way to diagnose asthma is for a health professional to watch your child before and after taking asthma medication and note, as a professional, if there is an improvement. If your child has preschool asthma, does it mean they'll have asthma for life? Well, asthma in children under 5 is very common in Australia. But less than half of these children will still have asthma when they start school. It's important to remember that many young children will grow out of their asthma. We want children to enjoy life, be outdoors and stay active. And the good news is, preschool asthma is treatable. If you understand what preschool asthma is and what to look for, you'll be able to manage your child's asthma with the help of your doctor. There are many things that can start or trigger an episode of asthma. Most preschool children will only get asthma symptoms with a viral infection, like a cold or the flu. Some children experience asthma when they're exercising. Changes in the weather, windy conditions, air pollution, pollen, cigarette smoke, even on clothes or furniture, can all trigger asthma. You can't always know when asthma symptoms will occur. To help you know when your child is having an asthma episode, it's helpful to know what your child's breathing looks like when they're well. If your child is having an episode of asthma, they'll have difficulty breathing. In a younger child, you may see your child breathing hard or fast, their tummy moving in and out with more effort, their throat sucking in and out, or their chest moving like this, with sucking in between the ribs. They may be less active, be unsettled, restless, or become irritable. Sometimes you may hear wheeze or a whistling sound when your child breathes out. Your child may cough, but children cough for many reasons, so cough alone doesn't mean they have asthma. Most asthma episodes are mild, but it's important to know what to do if things don't improve. Your child's asthma action plan explains what steps to take. With asthma, symptoms can get worse very quickly and can be life-threatening. In a severe episode, your child may be short of breath, wheezing, coughing, and may also become blue around the lips, be exhausted, floppy, and gasp for air. If your child's having an asthma episode and their medication is not helping quickly, or you're worried, you need to take action. Call 000 for an ambulance and start asthma first aid until the ambulance arrives. The 000 operator can calmly talk you through the situation. At times like this, it's normal to be worried or scared, but it's important to try and stay calm to help your child. If your child is at risk or known to have anaphylaxis, their adrenaline should be used first, followed by their asthma reliever medication. Be sure to follow their anaphylaxis action plan first and then their asthma action plan. So, how do we treat preschool asthma? Most asthma medicine is breathed in from an inhaler. We sometimes call it a puffer. Inhaled asthma treatment comes in two forms. There's reliever medication and preventer medication. Everyone who uses a puffer should also use a spacer. And if you're under 4, a face mask as well. Relievers help open up the airways by relaxing airway muscles to make it easier to breathe. We use relievers to relieve the symptoms of asthma when they happen. The most commonly used reliever medication is salbutamol, a blue puffer, commonly known as Ventolin. Relievers are needed when there are asthma signs, such as your child having trouble breathing. After giving a reliever, breathing should get better, usually in minutes. However, you need to watch your child's breathing and give more reliever if their breathing doesn't improve. Children aged 1 to 5 can have up to 6 puffs of salbutamol at a time. If your child needs reliever more often than every 3 hours, continue to give more reliever, follow your child's asthma action plan, and see a doctor or go to hospital. A preventer works by reducing the swelling and inflammation in the airways. By doing this, preventers help prevent asthma symptoms and episodes from happening. Preventers are usually taken through an inhaler, using a spacer and a mask in under 4s. The first-line preventer medication recommended in preschool-aged children with asthma is an inhaled low-dose steroid. Preventers in tablet form are used less often, but may be prescribed by your doctor to be used along with your child's inhaled preventer. This is in the uncommon case where the inhaled preventer doesn't work well enough. Preventers are prescribed when your child has ongoing, regular symptoms between asthma episodes. To do their job, preventers need to be taken every day, even when your child is feeling well. If you find your child is regularly short of breath when they run around, if they need their reliever more than twice a week, or if they cough most nights, even when they're well, you should speak with your doctor. During an asthma episode, use your child's reliever medication, following their asthma action plan. But remember to keep them on the same dose of their preventer medication. You don't need to stop the preventer or increase the dose. Your child's medication and asthma management plan should be reviewed every 6 months with your GP or paediatrician, or earlier if you think it's necessary. At this review, the preventer medication may be increased or decreased or stopped completely. Children with other allergic conditions like eczema, hay fever or food allergies are more likely to develop asthma. It's really important for children with food allergy or anaphylaxis to make sure that their asthma is well controlled. When giving puffers, both relievers and preventers, you should always use a spacer device and a spacer with a mask with children under 4. If you use an inhaler without a spacer, most of the medicine stays inside the child's mouth and doesn't get to the lungs where it's needed. The spacer ensures that the medicine gets to the lungs. Please watch this short video to see how to best use a puffer, spacer and a mask for under 4s. The latest research tells us that prednisolone, a steroid that's swallowed, should only be given in hospital for severe episodes of asthma. When your child is first diagnosed with asthma, a doctor or nurse will take you through a personalised asthma action plan. This will help to guide you when your child is having an episode of asthma, what steps you can take and when to see a doctor. It's important to be familiar with your child's personalised asthma action plan. You should make sure that everyone who cares for your child also has a copy of this asthma action plan, such as your child's childcare centre or kindergarten, as well as grandparents and family, anyone who cares for your child at home or in the community. Your child's asthma symptoms may change during the year or as they grow older, so it's important that you have a regular review with your GP. Your child may grow out of their asthma and no longer need their medication. When you visit the doctor together, you should talk about you and your child's understanding of their asthma, what's happened with your child's asthma since their last visit, your child's inhaler technique and dose of preventer medication if prescribed. And it's important to get the flu vaccine each year. Remember, preschool asthma is common and treatable. Learning about your child's breathing difficulties can feel overwhelming. There's a lot of new information to remember. But you can care for your child confidently if you can recognise an asthma episode or asthma symptoms, know which medications to give and when to give them, and know how to follow your child's personalised asthma action plan. Please ask your doctor if you have any questions or concerns. And thanks for watching.